Hi everyone, welcome to UDoc. Today we're going to be talking about acne. So Hillary's going to start us off by telling us, what is acne?
Acne is spots. So it can range from a few pimples all the way to the other end of the scale, where you get really severely affected and you can get scarring, which is the main issue that we try to avoid. The spots are caused by an overproduction of sebum, which is the natural oily substance that all of our skin produces. Unfortunately, in acne, it builds up and then it gets clogged up in the pores, and that's what causes the spots.
And so who tends to be affected by this?
So it's mainly teenagers, but acne can present later in life in your 20s and 30s. It obviously has a huge psychological impact, obviously with teenagers being very aware of their skin. But there's lots that can be done, things that you can do at home and things that you can go to see your GP for.
Yeah, I think the first thing you can do is make sure that you are cleaning your face, and certainly doing it at least once a day, sometimes twice a day, and making sure that you're using a separate towel for the areas that are affected by acne to the rest of your body can make a big difference in some people. Overwashing can be counterproductive, so don't exceed that amount. What else?
So it's really important not to scrub your face because you will damage the skin. And that question whether to squeeze or not, if the pimple is on the surface and without digging your nails in you can squeeze it, then I say I'm a squeezer. What about you guys?
I'm a squeezer.
Squeezers all round.
Absolutely.
And what about moisturising and things like that?
So moisturising is really important. But you want to stick to a non-oily moisturiser,
Right.
but do that regularly.
Okay. And what about the kind of things you eat and drink? Does that impact at all?
Generally speaking, keeping well hydrated is always important. So drinking plenty of water, making sure that you're flushing through your system. Some people do notice that certain foods can trigger their acne. There's less evidence now, there's very little evidence nowadays to say that diet has a huge influence over our skin, but if there are some triggers, the common sense would be to avoid what triggers your acne.
Yeah, I think just seeing what affects you is the most important thing. If you know something's going to do it, just avoid it.
Yeah,
Simple as that. Big question, especially around kind of like the kind of age group that we're talking about, is makeup. And should you use it? Should you not use it? What's the?
Well, I think if you want to wear makeup, if you're a teenage girl or boy and you want to wear makeup, no one's going to tell you that you can't. Certainly, I wouldn't have as a teenager. So the common sense approach is, if you want to wear makeup, choose a water-based foundation rather than an oil-based one. Try to keep it to a minimum, as much as will keep you feeling comfortable that you can present yourself. And then at the end of the day, make sure that you're washing your face well, getting rid of all that makeup so it's not clogging your pores up overnight.
Very good. So if you've tried all that and it doesn't seem to be working for you and you're still suffering with your skin, then you need to watch our next video, which you can find just here if you have to click, and we'll talk about what to expect when you go to see your GP.